Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my boards exam, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about what causes bursitis. If you have a patient or are a patient who has bursitis due to overuse and repetitive movements, this video is for you. Let's talk about what a bursa is first. Bursas are fluid-filled sacs that are generally located in regions of high movement. So think about places like the shoulder, the knee, the hip, the elbow, among many others. The purpose of the bursa is to provide a surface for tendons and muscles and bones to glide over smoothly. Additionally, they also help with shock absorption. Each time that we walk, we need to absorb forces. We need shock absorption. Each time we're hitting a tennis ball or a baseball, we need shock absorption. Every time I go grab something, I need shock absorption. Even though a bursa is designed for this task, it can only handle so much. Same thing with other structures in our body. Think about bones. They can only handle so much, and when they can't handle it anymore, it results in a fracture. Same thing with muscles. It can't handle it anymore, so it results in a tear. It results in strains. So let's go through some examples of things that might cause bursitis. Let's say we're sedentary and we decide to pick up a new sport like tennis. So I'm playing 2-3 hours a day, every other day. Constant overhead movements. I'm serving all the time. Maybe we started a new job where I'm now delivering packages and I have to squat low and pick up items from the floor all the time, and items that might be heavy. So these are examples of sedentary people going to more active lifestyle. But I could also be a collegiate level athlete or high level athlete, such as a cyclist. A lot of movement, constant movement at the hip joint, the knee joint. So whether or not someone is sedentary or even a high level athlete, bursitis can happen to anyone. And the reason people get bursitis is because the bursa just cannot handle the load that's placed onto it anymore. What actually causes bursitis though? Because not everyone gets bursitis. Ultimately, the reason we get bursitis is because the muscles surrounding the bursa are not strong enough and do not provide enough stability to the region that the bursa is in. And because the muscles are not strong enough, this leads the bursa into taking more friction, more forces, and more load. Let's do an example looking at the knee joint. When you look at the knee joint, look at everything that's involved. We have muscles, bones, tendons, meniscus, ligament, a bursa. Now, all of these structures do handle load. So if I walk, my bones take the load. My muscles, my tendons, my ligaments, and the bursa, they all take the load. In the case of bursitis, the friction, the intensity of the load, it's just too much for the bursa. And it causes it to have inflammation, which is what bursitis is, inflammation of the bursa. Out of all the tissues that I've mentioned, again, bones, tendons, meniscus, all of these, the only one that we can consciously control and strengthen is our muscle. Now, I can make my bones denser through movement and strength training and walking, and I can make my tendons stronger by strengthening my muscles, but ultimately it's the muscle that we can truly control. Think about a knee that has small muscles versus a knee that has large muscles. If both of these knees were to jump up and down, which one between the two would experience less impact and less force on the bones, bursa, ligaments, and meniscus? The answer is the one with the large muscles, and this is because more muscles equals more shock absorption. So considering both knees, I'm jumping up and down, both knees experience the same load and forces. If I'm 150 pounds, that knee is going to experience 150 pounds of force. All tissues, bones, meniscus, bursa, ligaments, etc., they all feel that 150 pounds of force. But if you have a larger muscle, the muscle can help offload the force from the other tissues. So let's say that the small muscle takes 50% of the force, leaving 50% for the bones, meniscus, bursa, etc. But the large muscle might take 80% of the force, leaving only 20% onto the bones, meniscus, bursa, etc. Here's the situation. Let's say I've got a small muscle, or really it's a muscle that is not strong enough for the activity that I'm doing, or a muscle that doesn't have enough endurance for the level of activity that I'm doing. Maybe one jump up and down isn't going to make much of a big deal to the bursa, but what if I'm starting to run? I'm training for a 5K. I'm training for a marathon. This 150 pounds of force on the knee from every single stride that I make over and over and over again, it will have an impact on the bursa. The bursa would much rather experience only 20% of a repeated 150 pounds of force versus a 50% of a repeated 150 pounds of force. The inability of our muscles to assist the bursa in decreasing the amount of load and friction the bursa can take is the cause of bursitis, and it's this knowledge that we use to also treat bursitis. There are 160 bursa in the body, so check out our other videos on how to treat bursitis in specific regions. Don't forget to check out our NPTE courses at sptwithme.com. Check out these references for more information.